Hello everyone, this side Dr. Abhijit, and now we are going to discuss about arterial development and its anomalies. So let's start. Now we already know about the heart tube, right? We already know about the heart tube. So we have the uppermost portion that is called as the bulbous cordis, right? This is called as the bulbous cordis. Yes, this is the bulbous cordis, right? We have the other parts, right? So as of now I will be concentrating only on the bulbous cordis, right? We have the primitive atrium, the primitive ventricles, and we have this sinus venosus, which is having two horns, right? The right horn and the left horn of the sinus venosus. So as of now we already know the cranial end, it is forming the arteries, right? It is forming the arteries. So we have an area over here, right? We have an area over here that is called as the truncus arteriosus. The topmost area, or I would say the proximal area of the bulbous cordis. This is called as the truncus arteriosus. This is called as the truncus arteriosus, right? Now this truncus arteriosus will give two horns, right? It will give two horns, the right and the left horn of the truncus arteriosus, the right and the left horn of the truncus arteriosus. Now you already know that the heart, it is developing in the front, right, in the ventral part, and there are arteries, the dorsal aorta. If we say the dorsal aorta, it is developing posteriorly, right? So we have two pairs of dorsal aorta. So initially you already know we have two pairs of dorsal aorta, the right dorsal aorta and the left dorsal aorta. Now these two dorsal aortas, basically they are developing behind and heart is in front. So there is a connection between the anterior heart and the posterior dorsal aorta, and this is by the help of these pharyngeal arches, right? There are pharyngeal arches, they are 6 in numbers. These are pharyngeal arteries, I would say. Yeah, these are pharyngeal arteries. They are 6 in number, right? They are 6 in number. Now diagram में तो लग रहा है it is coming from the sides. It is coming from the sides, but actually it is coming from behind, right? So again, heart is in front, dorsal aorta is at the back, and the arteries which are connecting this, it is called as the pharyngeal arteries. These all are the pharyngeal arteries. We have the 6 pharyngeal arteries. So ये according to the diagram it is लगेगा कि side से आ रहा है, but it is not like that. Heart is developing in front. Dorsal aorta, aorta का नाम ही dorsal aorta है. Why? Because it is giving off branches to this growing heart, and it is like coming in front, and these are the pharyngeal arteries, right? So we will discuss about this in detail now. Okay. So now remember the truncus arteriosus. The truncus arteriosus, it divides to form the ventral part and the dorsal part. Okay, so we have the ventral part of the truncus arteriosus and we have the dorsal part of the truncus arteriosus. The ventral part will form the ascending aorta. Ventral part will form the ascending aorta, and the dorsal part will form the pulmonary trunk, right? It will form the pulmonary trunk, right? So let's discuss about this. So just what I have told you right now, you already know that suppose this is the truncus arteriosus. Now let me just draw like this. This is the truncus arteriosus. So this is the ventral part, and there will be one more part of the truncus arteriosus that is developed behind. This is called as the truncus arteriosus only, but it is the dorsal part. It is the dorsal part. So yes, remember now let us suppose this is the two abdominal aortas, right? The two abdominal aortas which are uniting together, okay, and they are forming a common descending aorta like this. They are uniting together. So this is the right dorsal aorta, and we have the left dorsal aorta. Now, the first 5 pharyngeal arteries, okay, they will connect to the ventral part. 1, 2, 3, 4 and 5. The first 5 pharyngeal arteries will connect to the ventral part, and the sixth one, okay, the sixth one, it is the, it will connect to the dorsal part. So I'm just drawing it with blue. This is the pulmonary trunk, right? So it is like this only. So yes, this is the sixth arch artery. So as of now, I will take this ventral and dorsal part as one only and will now try to explain. But remember beta, dorsal part, it is the sixth pharyngeal artery, right, which is connecting the dorsal part of this truncus arteriosus to the left dorsal aorta. So let us just draw a diagram, and this will be a big diagram, so kindly draw it in one, and like everything will be covered in this particular diagram only. So let us just discuss about this. So try to draw it like so let us first draw this. You already know we have the truncus arteriosus, right? The truncus arteriosus. Now this truncus arteriosus divides into two parts, right? Now this truncus arteriosus, the topmost part of the truncus arteriosus, it is called as the aortic sac, okay? It is called as the aortic sac. I am writing AS like this. So over here mention it, it is the aortic sac. Aortic sac, it is the part of the truncus arteriosus only, right? And this aortic sac, it is having two branches over here, right? We have the right horn of the aortic sac, right? This is the right horn, and correspondingly we have the left horn of the aortic sac. So yes, if you just want to mark this, I'm just not writing it over here, so or you can just write down, okay, let's just mark this over here only. This is the left horn of aortic sac, and this is the right horn of aortic sac, right? This is the left horn and the right horn of the aortic sac. So you can just draw this. Now you already know we have the right dorsal aorta, okay? We have this right dorsal aorta. Try to draw this dotted. We have this right dorsal aorta, and correspondingly we have this left dorsal aorta, right? So these dorsal aorta, they are basically meeting, okay, like this. So yes, let us just label this. This is the right dorsal aorta. Initially we have two aortas, right? The right dorsal aorta and the left dorsal aorta. The left dorsal aorta. So now we have the 6 pharyngeal arteries, right? We have the 6 pharyngeal arteries. They are connecting to the right horn and the left horn respectively. So just remember these 6 pharyngeal arteries over here. So try to draw them like nicely. So this is the, let us suppose this is the first, yes, this is the first pharyngeal artery. This is the second pharyngeal artery, okay? We have the second pharyngeal artery. Then we have the third, fourth, fifth and sixth. Similarly, on the right hand side also, we have this third pharyngeal artery, right? We have the fourth pharyngeal artery, the fifth and the sixth pharyngeal artery, right? The sixth pharyngeal artery, it is connecting to the ventral part, right? So as of now, I have just included one part over here, that is the right horn of the aortic sac and left horn of the aortic sac. This aortic sac is nothing but it is a part of the truncus arteriosus only. It is a part of the truncus arteriosus only. Now, let us just now discuss. Now you already know the main aorta. Okay, if you just know the basics, you already know about this, that we have the left atrium, then we have the left ventricle. Okay, this is the left atrium, left ventricle, and then when we have the arch of aorta, this aorta. So aorta is basically developed on the left hand side. Aorta, it is developed on the left hand side. So remember we have, now let us first understand the development of the arch of aorta. Okay, the arch of aorta. So the arch of aorta, just try to follow this. Yes, just try to follow this. Yes. Now this arch of the aorta, it is developing from the aortic sac. Okay, it is coming from the aortic sac. It is developing from the left horn of the aortic sac, right? It is the left horn of the aortic sac. Then it is the fourth arch artery, right? It is the fourth arch artery which is giving rise to this, and ultimately we have this part, that is the left dorsal aorta. So these parts are giving rise to the arch of aorta. So let us just mark it and understand. Let us just mark it and understand. For example, let us suppose, yes, this is part A, part B, part C and part D. So write down arch of aorta. Okay, the arch of aorta, it is coming from four sources. It is coming from four sources, that is A plus B plus C plus D. Now what is A over here? A, it is the aortic sac. A, it is the aortic sac. B, it is the left horn of the aortic sac. Left horn of the aortic sac, right? Then C, we have the fourth pharyngeal artery, the fourth pharyngeal arch artery, and the D1, it is the left dorsal aorta, the left dorsal aorta. So arch of aorta, the first structure that we have studied, it is developed from four sources, A, B, C, D. The aortic sac, the left horn of the aortic sac, the C, it is the fourth pharyngeal artery. ऊपर से काउंट करेंगे ना, देखो ऊपर से क्या हो गया 1 2 3 और फिर क्या आ गया 4 5 6, right? So yes, that is how the arch of aorta is being developed. That is how the arch of aorta is being developed. Now we have the left subclavian artery, right? Left common carotid artery and brachiocephalic trunk. Brachiocephalic trunk. तो आर्च ऑफ आयोटा के तीन ब्रांचेस होते हैं, लेफ्ट सबक्लेवियन आर्टरी, लेफ्ट कॉमन कैरोटिड आर्टरी एंड ब्रेकियोसेफेलिक ट्रंक. नाउ दिस लेफ्ट सबक्लेवियन आर्टरी, सॉरी, this left common carotid artery again breaks into two parts, right? We have the left internal carotid artery and left external carotid artery. So let us now just talk about the left subclavian artery. Left subclavian artery. So remember, the left subclavian artery, it is coming over here from this particular branch, and this is called as the left seventh cervical artery. Left seventh cervical artery. Okay, this is the left seventh cervical artery or left seventh cervical intersegmental artery. Intersegmental artery. Similarly, on the right side also we will have this artery that is called as the right seventh cervical intersegmental artery. intersegmental artery. Now we have various segmental arteries. Okay, we have various intersegmental arteries. Just have shown you the 7th cervical one. We have the first cervical intersegmental artery, second, third, fourth, fifth, sixth, seventh. Seventh will give rise to the subclavian artery. You already know this subclavian artery will go and form the brachial artery, ulnar artery, and radial artery, right? So yes, this is the 7th cervical intersegmental artery which will form the subclavian artery. Below also this we have various arteries. Thoracic intersegmental arteries are there, right? First thoracic intersegmental artery, second thoracic intersegmental artery, 12th thoracic intersegmental artery. But over here you have to remember that this 7th cervical intersegmental artery, okay, it will give rise to, right, it will, yes, remember, it will give rise to left subclavian artery in future. Left subclavian artery in future. Now you already know the left subclavian artery, it is a branch of aorta, right? Over here you can see also that it is see, embryologically it is seen that it is coming from the arch of aorta, but actually it is not. It is the 7th cervical artery which is now developing into it. But definitely we know, read it as it is a branch of arch of aorta, and which you can see also. But it's not coming from that. It is the 7th cervical artery. So indirectly we can say that. Right one, we will talk about it a little bit later. Now, you already know the other branch, that is the common carotid artery. The common carotid artery. Now, the common carotid artery over here, just try to see it over here. Yes, this part. This part will give rise to the left common carotid artery. That is the 3rd pharyngeal artery. Okay, this is the 3rd pharyngeal artery. Okay, which is giving to rise to the left common carotid artery. Okay, and yes, it will also give rise to the 2 branches over here. We have the, yes, this branch, that is the internal carotid artery, and there will be a bud which will be developed over here. There will be a bud which will be developed over here, that is called as the external carotid artery bud, right? External carotid artery bud. So this is the external carotid artery bud. This too. Now let us mark this as E. Okay, let us mark this as E over here, F over here, and G over here, right? E, F, and G. So the E part, okay, now we are studying about this left common carotid artery. It is like same on both the sides for this artery, left common carotid artery. Now it is coming from, yes, E part, and E is nothing. E is nothing. It is the proximal part. Okay, it is the proximal part of the 3rd pharyngeal arch artery. 3rd pharyngeal arch artery. It is the proximal part of the 3rd pharyngeal arch artery. Then we have F plus G. Okay, this F plus G, remember this F plus G will give rise to the left internal carotid artery. The left internal carotid artery. Now this F is what? It is the distal part of 3rd pharyngeal arch artery, and G, it is the left dorsal aorta. Left dorsal aorta. They both will contribute to give rise to the internal carotid artery. They both will give rise to the internal carotid artery. And obviously the external carotid artery, it will be developed as a bud. Okay, it will be developed as a bud on 3rd arch artery. On 3rd arch artery. It will be developed as a bud on the third arch artery, right? So this is about the branches that you can see over here, the common carotid and all these branches, right? Now on the right side again it will be the same thing. On the right side again it will be the same thing. You can see over here, yes, the third pharyngeal arch artery. Okay, it will give rise to the common carotid artery, right? The common carotid artery. Yes. Then we already know about, yeah, the right internal carotid artery, right? This is the right internal carotid artery. It will be formed, right? And there will be a bud which will be developing on them, right? So this is the bud which is developing on the third arch artery, right? So the same goes for the right side also. The same goes for the right side also. Now, okay, if you have not mentioned, beta, just try to mention over here aortic, yeah, sac. It is the part of truncus arteriosus. It is the part of truncus arteriosus, right? It is the part of truncus arteriosus. Now we already know that. Now coming on to the subclavian artery. So left 7th cervical intersegmental artery will give rise to the left subclavian artery, but it is not in the right side. It is not in the right side, right? So right wala part, what exactly it will be? Okay. So yes, if we talk about the right subclavian artery, so remember it is, yes, it is the fourth arch artery. Okay, it is the complete fourth arch artery which is coming. Okay, the right dorsal aorta and this right 7th cervical intersegmental artery. So these parts. So let us just try to, yeah, summarize it. Let me just give them names: 1, 2 and 3. 1, 2 and 3. Now this will give rise to the right subclavian artery. Right subclavian artery. So right subclavian artery, the first one, it is the, yeah, it is the fourth pharyngeal arch artery. Fourth pharyngeal arch artery. Then we have the dorsal aorta. This is the entire dorsal aorta only, dorsal aorta. And we have the right 7th cervical intersegmental artery. Intersegmental artery, 7th cervical intersegmental artery, right? So yes, now see, majority of the things are done over here. So you already know there are some structures called as the lung buds. So let us just try to draw this. Suppose this is the, yes, this is the lung buds. The lung buds, basically they are 2 in number, right? The right and the left lung buds, right? Now already I have told you the 6th arch artery, it is coming onto the dorsal, okay, the dorsal part, okay, of this aortic sac, right? The truncus arteriosus, the dorsal part, right? So the 6th arch artery, it is the one which will form, yes, the pulmonary artery. And yes, it is not the entire 6th arch artery which is forming the pulmonary artery. It is only the proximal half of the 6th arch artery. So if I ask you over here, let us just write over here only. Yes. If I ask you the pulmonary artery, so it is arising from the proximal part, okay, the proximal part of the 6th pharyngeal arch artery, 6th pharyngeal arch artery. It It is arising from the proximal part of the sixth pharyngeal arch arteries. Now you can all see a connection over here. If you can just focus beta, if this is the pulmonary artery and this is the aorta, okay, the left dorsal aorta. So this connection over here, it is called as the ductus arteriosus. This connection over here will be the ductus arteriosus. It helps in the shunting of the blood. See, the lungs are not developed at that time. So anyways, the blood from the pulmonary arteries have to go to the aorta, right? So there is a connection in the initial stages, and that connection you can see over here between the pulmonary artery and the left dorsal aorta, and this is called as the ductus arteriosus. Now let us just write about this. You already know the ductus arteriosus. Now these are connection between pulmonary artery to aorta. These are connection between pulmonary artery to aorta. Pulmonary artery to aorta, right? Now they are derived from, if I tell you, they are derived from the sixth arch artery only. They are coming from the sixth arch artery, but it is not the proximal part. It is the distal part of the sixth arch artery, right? It is the distal part of the sixth arch artery. So they are derived from the distal part of the sixth arch artery. They are derived from the distal part of the sixth arch artery. Okay, so again you can see over here they are derived from the distal part of the sixth arch artery. Now, what about the other arch arteries? So remember, the remnant of the first arch artery. Okay, ductus arteriosus का remnant क्या होता है? Remnant of ductus arteriosus, it is ligamentum arteriosum. Okay, remnant, it is ligamentum arteriosum. Coming on to the remnant of the first arch artery. First arch artery, it is maxillary artery. It is the maxillary artery. Remnant of the second arch artery. Second arch artery, it is the hyoidal and stapedial artery. Hyoidal and stapedial artery. Stapedial artery. So if you can just see, this external carotid artery bud will develop. Okay, it will grow. So again, this maxillary artery which is developing from this first pharyngeal arch, it will come in contact with the this external carotid artery. So that's why it is the longest branch of the external carotid artery. Matlab, embryologically it is not, but see how if the external carotid artery is growing, so what comes in the way, it is the maxillary artery. So again, it is like that, it will be a branch of this external carotid artery, and this is the longest branch of the external carotid artery, right? Now next point. Now physiological closure of ductus arteriosus. Physiological closure of ductus arteriosus, it is immediately after birth, right? It is immediately after birth. And the anatomical closure of ductus arteriosus, it is 1 to 3 months after birth. It is 1 to 3 months after birth. So yes, that was about the fate, but remember this fifth arch artery, anyways this fifth pharyngeal arch has to disappear. This arch artery has to disappear. It has no role. It has no role, right? Now let us understand this. We already know we have this right dorsal aorta. Okay, we have this right dorsal aorta. and yes, we have this left dorsal aorta, right? So let us, okay, let us just draw this first, the right and the left dorsal aorta, right? They both are meeting with each other and they are commonly, no, they are fusing. So this one, okay, let us just mark this. This is the right dorsal aorta and this is the left dorsal aorta. Now these two aortas, basically they are fusing with each other, right? And this is called as the fused dorsal aorta. Fused dorsal aorta, right? Fused dorsal aorta. Okay. So yes, we have a connection over here. So let's suppose this is the fourth pharyngeal arch artery. Fourth pharyngeal arch artery, right? This is the fourth pharyngeal arch artery. Okay. And yeah, it's coming from this horns, right? And over here you already know we have the arch of aorta, it is arising, the arch of aorta, it is arising, and it is like formed from this particular part, right? The aortic sac, the left horn of the aortic sac, the fourth pharyngeal arch artery, and the left dorsal aorta. So this is the aortic, okay, this is the how the aorta is formed, okay. So this part, it is the caudal part of left dorsal aorta, I can say, left dorsal aorta. So this part, it is the caudal part of the left dorsal aorta, right? And this fused dorsal aorta will together form, okay, will together give rise to, it will together give rise to the descending aorta. It will together give rise to the descending aorta. It will together give rise to the descending aorta. Okay. So yes, this was about this. Now let us assume a case, okay, if there is absence of this pharyngeal arch artery, if there is absence of this pharyngeal arch artery, fourth pharyngeal arch artery, okay, now what will happen? How will the subclavian artery develop? Now the subclavian artery, which is like present over here like this, okay, which is present over here like this, okay, now what will happen? This is the seventh cervical intersegmental arteries, right, 7 cervical intersegmental arteries. Now what will happen? These right 7 cervical intersegmental arteries along with this, so there will be formation of the right subclavian artery, but from now these parts, from these parts now, okay, from these parts now. Now what are these parts? You already know we have this dorsal aorta, right? So yes, remember, if there is absence of right fourth arch artery, okay, right fourth arch artery, or if there is persistence of caudal part of right dorsal aorta, अगर ये right dorsal aorta का caudal part persist कर जाए, right dorsal aorta, then both of these things will give rise to one of the anomaly, and that is called as the abnormal right subclavian artery, abnormal right subclavian artery. Now what this abnormal right subclavian artery will do, over here we have a structure that is called as the esophagus, okay, over here we have a structure that is called as the esophagus, which is there, which is there. So yes, this abnormal right subclavian artery will try to compress the esophagus. So this abnormal right subclavian artery, okay, what it will do, it will compress the esophagus, and it will lead to dysphagia lusoria. it will lead to dysphagia lusoria, right? It will compress the esophagus, okay, the right subclavian artery. It will be called as the dysphagia lusoria. There could be another condition, okay? There could be another condition. Now assume beta, assume over here, if there is persistence of this fourth pharyngeal arch artery also, and persistence of this caudal part of the right dorsal aorta, then there will be another arch of aorta will be formed. Another arch of aorta will be formed like this, बिल्कुल heart shape बन जाएगा. So this is called as the double arch of aorta. Okay, this is called as the double arch of aorta. Double arch of aorta. It is also called as the vascular ring. Vascular ring. Okay, so there is persistence of the fourth arch artery, okay, plus there is persistence of the caudal part of right dorsal aorta. Right dorsal aorta. So yes, why it is called as the vascular ring? Because it is forming a ring. It is forming a ring. In between we have the esophagus, and we also have one structure that is called as trachea. Okay, so it is forming a ring. So we have a heart shaped ring that is called as the double arch of aorta, right? So over here the patient, the baby, basically it will suffer from dyspnea. Okay, difficulty in breathing will be there, dysphagia will be there. So there will be these symptoms that it will appear, right? It will appear. So that was about the arterial development and the branches of the arch of aorta. Thank you.